So a few months ago, a faithful viewer of my YouTube channel asked if I could bring one of her favorite YouTubers to this podcast. So shout out to you, Nasli. This one is for you. On this episode of Teeth Time, I'm talking to a fourth-year dental student from the UK. RainaOnTheCusp is a fellow dental YouTuber, and our conversation today includes her teaching me about dentistry in the UK, as well as the two of us reflecting on what dentistry means to us. I'm really excited for y'all to hear this one, so it's Teeth Time. Let's do this. Raina, welcome to the Teeth Time podcast. Thank you for being here today. How are you doing?
I'm good, thank you. Thank you so much for having me on.
So I have to just right out the gate tell everybody who's listening that this was by far the most difficult scheduling event that's ever happened, like known to man. So Raina and I have been talking for, what is it? It's probably been like a month, 2 months, maybe even longer. It's been a while.
Like 2 months, maybe, yeah.
And we finally been able to sit down and do this and record. And I think this is a wonderful opportunity for me because I've actually never spoken to anybody who's in dentistry in another country. So I'm not super well versed, but I know a good bit about dentistry in the US, and I feel like I know absolutely nothing about dentistry in the UK. So I'm really excited to get into things with you and just pick your brain about everything. So thank you for making this happen.
Yeah, no problem. I'm excited to get into it. Let's talk about everything.
Yeah. So the reason that we were able to get connected is I have a few viewers who are they comment on like all my videos and stuff, and I'm super thankful for them. And I think I released a podcast a few months ago, and somebody had commented, and then I asked who do you want to hear from, and this person immediately commented and said, I would love to hear from Raina on the Cusp. She's like my favorite. So I was like, all right, cool, we're gonna make this happen. But that just kind of takes me to my first question, which is not really dentistry related, but is sort of YouTube related. So I was wondering if you could just kind of give me like your history with YouTube, why you started, when you started, and sort of your thoughts on that whole process.
Yeah, of course. So I started, I think, in April 2020, just after the UK went into lockdown in March. I left dental school, like we all left dental school, went home, and I was looking for something to do. I'd always kind of considered potentially starting a YouTube channel, starting social media in general, just to help younger dental students and applicants. At this point, I was in third year, so I was almost 3 years into dentistry and the degree, so I knew a fair bit about the process and everything. And then I was speaking to my boyfriend about it, who encouraged me basically to go for it. No one from my dental school had really ever done anything like that before, so I was quite nervous about the whole process. But he helped me quite a lot in the beginning with just like getting everything set up. Like I said, encouraging me when I thought I was not very good in front of the camera initially. Like some of my initial videos are very, very painful, if anyone ever scrolls back that far. And yeah, it's just kind of grown from there. I have done videos for study tips, just applicant videos to help younger dental students and students in general. What else have I done? I do like vlogs every now and then, less so now because I treat patients, so we can't really film anything, but right. Yeah, it's just been going on since then.
Cool. Yeah. And I think a lot of us have a similar story with that, where it's like I would imagine that you have a lot of like influences or inspirations that you used to watch on YouTube. And I was the same way. I had all these people that like Karma Medic was, I think, the guy that I watched that made me think I could actually do the same thing and apply that to my career and my life. Because I was like, when I was younger, I always loved working with a camera, and I had a small YouTube channel and stuff. So I had done it in my past, and I was like, okay, what if if I get into dental school, what if I try to do this thing? And it's definitely strange. But I think it's been wonderful for me, and I don't want to speak for you, of course, but it's been a wonderful opportunity, just kind of like this, for example. I would never really have the opportunity to sit down and speak with a dental student across the world. It's just not something that I would get being here in Tennessee and just being in my little confined area. So being on the internet, putting myself out there, it's definitely been difficult. Like you said, like I can look back at my videos in the beginning and cringe. I'm like, oh my gosh, like, and I think about that now and I'm like, I'll probably next year look back at my current videos and be like, ooh, like, you know, that wasn't good. But like, that's what we do. We continue to grow. We continue to learn and get better at this thing. And I know you've taken some time off here and there, but like, I wouldn't just like as a smaller YouTuber than you, I would encourage you to keep doing it because you like the quality is wonderful. One like really specific thing is I love how much like B-roll you put into your talking videos because when we make these like talking head videos, it's just us sitting here with the camera. And at times it's like, okay, I want to see something else. So your videos are really like packed in with all sorts of shots of you doing different things. And that's something that I try to do as well because it keeps it visually interesting.
I get so bored of like even filming just talking head videos because I feel like there's not much else going on the screen unless you really put in the effort to add the B-roll and animations and graphics and music and sound and everything else. And I feel like a lot of people don't realize how many hours go into editing. So like I don't know, like a 7-8 minute video could take 7 hours or 8 hours plus to edit and
Absolutely.
fully produced, which is like a part-time job essentially.
Yeah, 100%. It's a lot, especially too as a student. Have you found the time management to be like, do you think that you could have done YouTube in your first and second years of dental school? Or do you think that it's maybe been slightly easier now that you're like in the clinic treating patients? Or what do you think about that?
Yeah, that's actually a really good question. I think in first and second year I had a lot of lectures. Like every semester I would have, I think maybe over 150 lectures or so. So I think the workload was a lot more in first and second year for me. So it's 5 years in the UK, if
Okay.
anyone's wondering. So in first and second year and third year, to be honest, we had a lot of lectures. So that would take up a lot of my time. But since I started fourth year and fifth year, we don't really have that many lectures anymore. We've kind of covered um, all of the
Right.
basics and everything. So yeah, I think time wise, I definitely have more time in between clinics now because all I'm really doing now is treating patients. I don't know how it works for you guys exactly and if you're at that stage yet, but
Well, yeah. So I actually was going to ask you about the format of school because it seemed slightly different. I was watching a video of yours and I saw that you were in your fourth year, and I didn't know if y'all did 4 years like we do, but so you do five. So yeah, so we have 4 years of dental school. The first two are completely didactic and preclinical. So we're in our technique lab, and then we're in the lecture hall. And then years 3 and 4, we get our first patients and start doing that process. I just started my second year, so I'll be in the preclinical lab for another year, and then next year at this time I'll get my first patients. So that'll be interesting. But yeah, so did you just get patients, or have you been treating patients now for some time?
yeah. So I've been treating patients since second year.
Okay, wow.
Um, Yeah, so it varies a little bit from dental school to dental school in the
Mhm.
UK. Some start in first year, even doing just basic things.
Mhm.
The university that I'm at, which is Sheffield, the University of Sheffield, we start in second year and we make dentures. That's the first thing that we do
Wow.
for a patient, which is really, really nice. It's a nice thing to begin with. And then, yeah, we just increase the number of clinics from there. We start on restorative, periodontics, and
Mhm.
then we have separate clinics for different specialties. So we have oral surgery clinics, for example, where we just take out teeth and we do
Right.
like minor surgical procedures on there. And yeah, we do get quite a lot of experience, to be honest, because we don't have an undergrad degree. I think you guys do like a
Yes.
is that yeah.
Yeah, I spent 4 years getting a degree in something that I actually will never use in my life. So it's a little
Yeah,
different.
I that blows my mind. That
Yeah.
honestly, like, I mean, yeah. I
Doesn't
guess
make
I
a
mean
lot of
you'll know a
sense.
lot. So here we go to university at 18, and then
Wow.
I'll be 23 when I graduate. So I'll be a dentist. Yeah.
Golly. I'm 24 right now, and I am not, I'm kind of sort of middle of the road in our class. We have people in our class that are in their 30s, and then we have a couple like the random odd people out that are like 21, but it's very common to be, I'll be 20, I guess I'll be 27 when I get out, 27, 28, which is insane. And then if you think about like med students in the United States, it's like 30. Being a doctor at 30 as a med student or as a going into medicine is like almost unheard of because they have, of course, all of their residency and extra time. So it's really interesting. Yeah, I've never understood the why we do it the way we do here in the US, where we have this, it's essentially 4 years of like a weed out process where they have you take, you have a science degree and such, and they essentially, they look at those 4 years to see that if you can do it. And I have always thought it makes more sense to just get people into the profession out of high school, or like you said, like roughly at 18. But that's what we do here. And like people ask me like, does that suck? Like, does this suck? And I'm like, yeah, I mean, all of my friends in my life are, they're starting to, like, they have their jobs, like their life career. They're starting to buy houses and like think
Yeah.
about cars and like all this stuff. And I'm like, yeah, I'm going to be like 28 before I have $1 in my account.
No, I mean, that's the same with me, except here, so people can do, most people do 3-year degrees, so they do from age 18 to 21.
Right.
So
Okay.
a lot of my friends that I knew from sort of high school, like you said, have now kind of moved on. They have jobs,
Hmm.
they're earning salaries and everything, and a lot of them have left uni, and I'm still here. So
Hmm.
yeah, I can relate to you on that one.
Yeah. And it's something I've found with this whole discussion is like, it's very easy to sit back and be like, oh my gosh, I don't want to be in school anymore. I wish I could just be, doing the job or whatever. And then you talk to people who are out and they're working and they're like, yeah, my job's not fun. So it's like what I've tried to find in my time is just like enjoy each step of the process in whatever way you can, and that'll make your life a little bit more fruitful. So speaking of like where we're at in dental school, like I wanted to go back a little bit and have you talk about kind of your first couple years and just think back to that time. So and it's a little different now in the context of the fact you were so young, but what were some of the things that maybe challenged you when you started dental school that you had to kind of work through?
Um, I think probably, obviously, number one, moving away from home. Um, yeah, so like at 18, most people tend to move away to university. So
Hmm.
obviously, I had to get used to living away from my parents, doing everything for myself. Secondly, definitely the workload. So in high school, we still had quite a big workload, but I think university is very independent, and you don't have teachers that are giving you homework,
Right.
and like following you up on things. And with exams, like you just have to revise the lecture content, and it is very much more independent. So I think I was struggling with that initially, definitely in the first semester. I think through first year, to be honest, it was all just very different. I'm trying to think what else. I think when I first started clinics in second year as well, um, I mean, you've not done this yet, but speaking to patients for the first time
Hmm.
is quite a big change, and having to explain things in a simple way and in a way that they understand is quite different again. And obviously, you're very nervous, like you're not quite sure if you're doing everything right.
Right.
Obviously, you're supervised and everything, but it's something that you get used to, and you do get better at it through dental school and as you do more clinics. So yeah, I think I'd say those three things.
So how much like hands-on preclinical stuff did you guys do in your first year, like in a lab, in like a technique lab? Did you do like a lot or a little?
Yeah, so I'm guessing you mean like phantom head labs, like with the
Yeah. Yeah, with like a mannequin, yeah.
yeah. In first year we didn't do that much. I think we might have been in for like 6 sessions in the whole
Wow.
year, something like that. Very, very few, because it was so knowledge and theory
Hmm.
based. So we were doing, all of the anatomy, the biochemistry, physiology, all of that kind of stuff. And then second year we were in quite a lot. I think maybe once or twice a week for
Okay.
like full like morning sessions or afternoon sessions. And then I think third year again we did a bit more, but at this point we're overlapping with treating patients, so
Right.
we are still in the labs but we are treating patients at the same time. So we're learning procedures, but then we go and do them on people, and obviously we have exams before we're allowed to do that. So we pass practical exams. But yeah, that's kind of the structure of what we do. And then fourth and fifth year, we don't have any labs. I think we just do clinics exclusively. So I might be in every single day on a different clinic, different rotation. So for example, tomorrow I'm on oral surgery in the morning, then pediatrics in the afternoon. So
And you're working with like residents in those or is it just professors that you're working with in those residencies?
Yeah, so the people that supervise us are dentists themselves, but they're also tutors,
Okay.
or professors, and they kind of look over everything that we do, check everything, and make sure it's fine.
Cool. That's awesome. Yeah. Once again, this is so interesting because like everyone, like my whole world and everyone I talk to, it's like this very standardized system in the United States of how we do it. And like, it's just so cool hearing a different system. Like when I asked that question, I didn't even think about the fact that it was 5 years. So I was like, wait a minute, if you have a full year of like not doing any hands-on stuff, wouldn't you be behind? And it's like, no, you have 5 years. So, cause like we do, like I said earlier, we have 2 full years of just like, we're in the lab a lot. Like it's a big portion of what we do. I was in there this morning, cutting a crown prep and stuff. So it's a big aspect of it. And then it's just sort of a balance. So like,
I think
last,
you guys, sorry,
you're
I
good.
think I was gonna say, I think you guys have like quite a lot of training. I feel like it's quite
Mhm.
intense from what I've seen. So like, I mean, I follow a few American dental students, and some of them I've seen can be in the lab at like 11 p.m. at night,
Yeah.
for
Yeah.
example, which is unheard of in the
Yeah.
UK. Like we finish at 5 p.m. Like we do not work past that unless we, have to. Like it's 9 till 5.
Right. Yeah. It's and also COVID too has changed the day to day schedule, but we definitely have like we'll have the lab open. So right now my class is making our first dentures, and I'm gonna just hope that the terminology is the same when it comes to the country difference. But the portion that we were just working on is the wax rims. So you make like your master cast, and then your, oh my gosh, I'm blanking on the spot. Basically, yeah, your wax rims, and they're just like they're super like annoying and tough. And our whole class was like, this is just the worst. And we had people, they were due this morning at 7:30, and we had people in the lab last night till 11 working on them. And like they've been assigned for a few weeks, but like stuff like that will happen where it's like you have to get these things done, especially in classes like denture where it's a bunch of lab work that you do, and instead of just like you're cutting preps or something. So yeah, it's a lot, but I think it's good because, like you say, the transition of, I would imagine, haven't done it yet, but the transition of going in and actually having your first patients and being seen as someone who is trusted to do these procedures on real people. It's you want to be prepared for that, and I don't think there's any way to be like super fully 100% prepared. You have to go through that learning process and that like awkward period of not really knowing what to say or how to be confident, but I would imagine that after some time, you learn to trust in the time you've spent learning this stuff, and you get to that point where you can just apply it to your patients, to their situations.
Yeah, definitely. I think the number one thing I've learned from dental school so far is that actually communication is the most important thing. You can be like the best dentist in the world, but it really doesn't matter if your patients don't like you, and
This is
and
true.
you can't communicate the treatment plan or their options, and you can't gain valid consent and things like that. So yeah, I think the thing that I've focused on more, in my sort of final years, I guess, of dental school is just trying to be nice to patients and speak to them in a way that they understand, and yeah, just building that rapport.
Yeah, that's huge. And people ask pretty frequently. I guess pre-dental students ask like, what did you do for your personal statement? So I'm assuming it's very similar. You write like an essay to get in, to be accepted into dental school, and basically the parameter of the personal statement is extremely it's extremely open. It's basically like, why do you want to be a dentist? It's like you could take it a million different ways. And so I kind of actually took it the communication route. So I always considered myself a decent writer. I used to, like, when I was younger in like middle school and stuff, I used to stay up in the middle of the night. My brother and I have a younger brother. We had like twin beds in our room, and I used to pull the covers over my head, and I had like a little reading light, and I would stay up late at night just reading books and stuff. And so I was always like really into reading, and then got into writing a little bit. And so I focused on something that was completely not like what you would think would be a core dentistry topic, which is communication. But in reality, I think communication is, like you said, one of the most important things, because every single day we're having to communicate with patients and in a way that in something that they don't understand. So it's very important that we can convey the idea to them, and then also we can do it in a sort of a gentle manner that allows them to trust us and to, it's there's a lot to it. And so I think it's more important than people would even like think it would be. So, and just thinking in the mind of a predental student, like they would probably ask like, okay, so how can I get better at communication, right? So it's like, do you have any recommendations for that?
Yeah, do you know what? I have thought about this before. It's a really good question. I think, well, at my university, we do communication sort of workshops in the earlier years. So that helps you do get into sort of role plays and get a bit better at communicating with each other. And I think just naturally you will get better as you see more patients. I think when I started, I definitely wasn't that good, but you do kind of learn your own style and the way that you explain things, and you just kind of follow the steps of what you would do in an appointment, so you don't have to think about that part, but then you can focus on getting to know the patient, if that makes sense.
Mm-hmm.
um, yeah, I think it's a hard question because it's not something that I've personally kind of actively thought about. I've
Right.
kind of just like trusted that hopefully with time I'll get better. Yeah, I think that's probably my main thing, is just to not give up when you're in there. If something doesn't go to plan in the appointment, maybe you get nervous, maybe you stumble, just keep going. You will get better in the future, I promise.
Yeah, and you're a very well-spoken person and a great communicator from what I can tell. And I think not to advise everybody to start a YouTube channel, but I would imagine that YouTube has kind of helped you with that, where it's like you're sitting down. Like I've gotten better at speaking because you have to sit down, and it always every time I hit record, it feels like my body temperature goes up and I feel like my blood pressure rising because I'm now in front of the camera, and you get better with talking and practicing speech and all of that. So it's one way that I think is better to that helps at getting better at communication. So let's talk about the future. Let's talk about the next couple of years, or the next 20, 30, 40 years, whatever it is. So
Oh
do you
God.
kind of have, I
Yeah.
know that might be a topic that's scary, but do you have any thoughts on kind of your future and things that you plan on doing?
Okay, so I mean, I graduate next year to start with. And in the UK, most people do an extra year of training to be able to work in the NHS. So we have a year called a foundation year. And in that year, we are working in a dental practice full time. We're under loose supervision of an educational supervisor, but we fully see our own patients and everything. Like we do all the treatment, and it's a year that we have to do in order to be registered onto the NHS if we ever want to work, or we can go fully private as well. um, so hopefully I will be doing that. I'm not sure exactly where yet. Maybe London. I'm thinking of maybe moving to the capital if I can afford it.
Right.
Yeah, and then I think after that we can choose to continue into specialization, so
Mhm.
we can do further training, or we can work as an associate dentist, which is just a dentist in a practice
Right.
full time. You can work part time. You can be a lecturer. You can go into the academic side. So there's lots of options. I'm not entirely sure which option I want to go down yet. I'm not sure if I want to specialize. I quite like the sound of orthodontics,
Okay.
um, but it's like another, how many years is it? Like maybe another 7 or 8 years to
Mhm.
specialize as an orthodontist. So initially, the years that we don't do at university, we you do afterwards into
Sure.
specialization. So yeah, that's where the longevity comes. So I don't know. I'll see. I can't really give a definitive answer right now.
That's okay. And I think that's totally fine. I think in talking to, I'm kind of like a odd case where like I kind of have my career figured out.
Oh
And
yeah, what have you?
to explain that, so my dad's a dentist, and he owns a practice in my hometown, and so I sort of had this option at a younger age where I was like, do I go into the family business or do I try to do something else and go into a different business? And once I was actually exposed to dentistry firsthand, it clicked for me and I knew it was what I wanted to do. But so that kind of has always, I always went into school knowing where my career would be and where it would take me. Most of the people that I talk to in my class and around me, they're trying to figure it out. And I think that's like, it's extremely common to go in and be like, I need to do this stuff before I like have this perfect vision of what my career is going to look like, because you really do. And I think dentistry is such a specific field that you could get into it, for example, and really not enjoy. You cannot enjoy crown and bridge, not enjoy operative. You could hate doing dentures, but you could love moving teeth. You could love orthodontics, or you could love endodontics or whatever. And so it's like, and you don't know that until you get in and you do it. Like, you can shadow all you want and see dentists day to day and see what their daily routine is and all that. But like, until you go in and you do it with your own hands, you kind of have no idea. So I think it's perfect. Do you have any thoughts about the other thing that was interesting is the NHS? That's a different, situation than what we have here. So what are your thoughts about NHS versus private practice? Like, is it like a 50-50 thing where like a lot of people go here, but other people do private? Like what is the setup with that?
Yeah, I think if I'm not mistaken, in the UK, most dentists have a split between working in the NHS and then private patients. There are a lot of benefits to dentistry in the NHS. Obviously, it provides for the majority of people who couldn't otherwise
Mhm.
afford private prices. Um, there's also like the NHS pension for dentists. They provide like sick pay, and it's salaried as well. So your income is kind of guaranteed on the NHS side, whereas with private, it's how many patients you see, what you charge, what kind of treatment you provide. So there's less security. So yeah, I think most people tend to do a bit of a mix. I'm not entirely sure what I'll probably end up doing, a bit of a mix, to be honest. I'm not entirely sure. It's quite flexible. Like if you do that year, foundation year, you can, always choose to come back and work in the NHS. You can do private for a bit. So yeah, it just really depends on what you want to do. Some treatments are not readily available in the NHS, for example, implants. So implants are mainly private. I think unless you've been in like an accident or something like that. So if that's your interest, obviously then you'll be going towards the private side. Things like Invisalign and sort of short-term orthodontics, all of that is private. So people generally tend to have a bit of a mix of whatever interests them.
Yeah. And it sounds like just on face value and my knowledge of this system is what you just told me. So it's limited, but it sounds like the working for the NHS for a little bit would be a good way to kind of gain some like a sort of a leg up financially if you want to go in and specialize and spend more time in school, so you can make some money, you have a guaranteed salary, and you don't have to worry about, because private practice, no matter where you are, it's going to be tough. And of course there are situations that are more established and set up, but running a private practice has its own hardships. So it's a really good system. I think in the United States, the way I would kind of compare it to that is, now we sort of have a lot of dentistry in the United States is corporate, and there's a big discussion out there on whether that's a good or bad thing. I think there are good things and there are bad things about it, but it sort of acts in the same way that the NHS would, where these big corporations own dental practices all over, and they basically go out and they get young students who are just getting out, and they offer them a relatively good salary, and that gives them security, and then they can provide dental work to typically it's once again to patients who don't have as much financial freedom to go out and get private practice dentistry that's really expensive and really like sort of high end. So it like I said, it functions in a very similar way, and a lot of students get out now and they need to start paying back on the crazy loans that we have to take out, and so corporate looks really appealing to a lot of people.
Yeah, that's another thing that I wanted to ask you about, because our university fees are, I believe, much, much lower.
Okay. Yeah.
So like we pay £9,250 per year for it, which I think,
Just
yeah,
outrageous.
but I think you pay like, is it hundreds of thousands?
Yeah. So my tuition per year I'm an in-state student. I was born and raised in Nashville, Tennessee, and I'm in school in Memphis, Tennessee. So in-state tuition, which is always cheaper, and I pay around 70,000 a year. So it's a lot. And it's like, it's really a discussion that I haven't gotten into a whole lot with my channel and stuff. And I plan to get into it more. There's actually a book on my shelf up here that was written by a guy, his name is Dr. Jim Dolly. He goes by the White Coat Investor, and he wrote a book about investing for dental and medical students and how to sort of start approaching this process of like paying back on these massive loans. So yeah, like tuition in the United States is getting to a point where it's very out of hand, and I don't know how far it goes. I don't know if there's even a cap on it at this point, and it's really an interesting thing. But yeah, it's a lot of money that you take out in loans, and it's just the first however many years of your practice. It's really prioritizing paying back on those loans, trying to get a good interest rate that's not going to kill you, and just trying to tackle it. So yeah, the prospect of paying 9,000 and the pound dollar conversion is, if I am correct, it's pretty close. So that's pretty insane. I wish I was paying that.
But I mean, we do have a much lower salary if I'm also mistaken.
So it's who knows, but I think at the end of the day, we're all excited about our futures, especially us students. We're kind of ready to go and to see what the profession has to offer us. And like I said earlier, it's every step of the way. And having my YouTube channel, I interact with pre-dental students. That's my audience. So I see that anticipation that they have, where it's like, I'm so ready to be in dental school, and I'm like, well, you're going to be there someday, but try to enjoy what you have right now, because each step of the process is special in its own way. So we have to make the best out of it. Yeah,
it's definitely really, really rewarding, because I just feel like you can do so many things for a patient, and that there are so many different options and treatments you can provide. Like no 2 days are the same for me right now, which is nice. So like I don't ever get bored. I love speaking to people. I like problem solving as well, and like seeing what I can actually do and how I can sort something out for them. So yeah, I think that, so far, I'm going into my 5th year and I'm still really, really enjoying it. So yeah, I think I've definitely chosen the right profession.
That's good. And that's such a valuable thing too. And yeah, I say this a lot because I don't know it firsthand, but every patient is different. Every human body is different. So every patient presents a unique opportunity, a unique challenge. And that's one of the cool things about dentistry. We're not working with pen and paper. We're working with tissue, and it's ever changing. It's ever different. So we have it's a lot of responsibility. I think it can make the job difficult. It can put a lot of weight on your shoulders, because you have to try to standardize something that is very that once again is ever changing. But it also, like you say, it gives us the opportunity to impact people in ways that I don't think we would have the ability to do in other professions. So it's a great thing. I could talk about dentistry for days, but and you do the same thing that I do, which is to try to help pre-dental students. I try to give advice, but and I know you've given advice in this podcast already, but if you had to like kind of give one piece of advice to a pre-dental student, what would it be?
If I was to give one piece of advice, I would say the most important thing is to figure out your why and remember your why as well, because I guess you can agree with this, but some days can be very, very stressful. For example, yesterday I started a molar root canal treatment on a patient, and yeah, if you know anything about that, that's one of the more tricky procedures that we do. Yeah. So yeah, just remember your why basically, and just remember there are options for you if you're not quite enjoying something. Once you do get in, then there's several different ways you can. And also, whilst you're applying, remember to look at the entry requirements for that university as well. It can, for us in the UK, at least it can differ slightly, so play to your strengths.
Certainly. Yeah. And I think in terms of the why, like, it's important to be able to, when you're a younger student, it's important to be able to form that why, like what about dentistry is exciting to you, or what draws you to the profession. Nobody should go into dentistry because you and I make videos about it. Like it should be more personal. It should be more of an intimate thing where like you experience the profession and you're drawn to it. And you don't have to see it and be like, oh, I'm in love with that. But you need to be able to see it and be like, that looks like something that I can do in my life. And that looks like something that could be fulfilling for me. So, form that why. And then, like you say, when you're going through the process of like studying for the DAT, we have the DAT. I don't know if you guys have a different test. You think you have a different test, but
yeah, we have that.
yeah. So similar thing though, when you're going through this standardized testing process, it's grueling. You're going through applying, it's grueling. Remember your why, like Raina says. So I have one more question, which is I like almost I feel like I'm being trolled here, but according to your Instagram, Ali Abdaal follows you.
Yes.
What the heck?
Oh, this is a whole story.
I want to hear like what the heck? How is that a thing?
Yeah, basically, it's not that deep. We're forest.
Did you send him a message about? Did you send him an email about getting married? Is that what it was?
Oh my gosh, no, I don't. I think he gets enough of those already. No, so basically, his YouTuber course, his part-time YouTuber academy. I was on cohort 2. And then I became a student supporter for cohort 3, and I was reviewing other people's videos. So yeah, just through that, basically, I was kind of on his team, I guess.
Cool. Well, was that a fun process? Was that something that was like really cool for you?
Yeah, no, it was great. I mean, I loved cohort 2. Like the course is amazing. If anyone is a student watching this, you can apply for a scholarship that would get you on for free as well. So yeah, it was amazing. And then I kind of emailed being like, look, I'd love to help. Is there any way that I can help? And they needed some help with the feedback and giving people feedback, because the course has got so big now. There's so many students. So yeah, basically through that.
Yeah, it's incredible. And Ali is another one who I have followed for a few years now, and just I mean, how could he not be inspiring? It's really cool to see what he's done with just like, and I think he's a good example of somebody who started with a very niche topic on YouTube. I guess med school is pretty big now, but he's one of the reasons for that. He started with a niche topic talking about the UCAT and these different things that a few people would watch, and he stuck with it. He stayed persistent. He made content, and then now he can make content about him playing a video game or sleeping or something, and a million people watch it. And it's cool. It's inspiring, and I think it's a great lesson in staying persistent, because just in the time that I've been doing the YouTube stuff basically for a year now, it's like it grows very, very slowly at the start, but every week it grows faster. And I think that's like, it's a good allegory for life, I guess, where it's just like, you have to put in time and effort to things in order to see the fruits of the labor. So nothing is just going to come and plop down in front of you and you just have it. You have to put in that work. So I saw that. I was like, is this like another Ali Abdaal? Like, what am I missing something here? Cause this is incredible.
No. Yeah. Like I said, it wasn't that deep, but yeah, I mean, one thing he's always said is that if you do want to get into YouTube or any kind of, I guess, venture where you're trying to grow something, like if you do it consistently, so with YouTube, if you do one video a week for 2 years, is what he says, like your life will change. And I can definitely agree with that. I don't have the biggest following or anything, but I have had so many opportunities like this one, and to meet different people, and be in contact with brands, and yeah, just put myself in a better position, I think, for the future. So yeah, I think overall, like, I've had such a positive experience with it. And yeah, if anyone wants any advice, feel free to message me.
Yeah, we have plenty of it, and I would agree with everything. Like I said earlier, I don't think everybody needs to go out and make a YouTube channel necessarily, but it has been a really awesome thing for me to do, and it's allowed me to connect with a lot of people. And you're a perfect example of that. Just somebody that I would have never met, and we get to have a good conversation. So I appreciate you coming on here. I appreciate you dealing with my scheduling woes and all of the things that we had to deal with to make this happen. But this was great, and I love to once again to hear a different perspective about dentistry, because I think it's very easy for me to get in a rut of like, this is what dentistry is and this is how I see it. And so hearing a different perspective is really good for me. And also too, just recognizing that at the end of the day, it's all about helping other people and making a positive impact on those around you. So thank you for the words of wisdom and for being here.
Thank you for having me. I really, really enjoyed it.
Heck yeah. So we'll have to talk to you again in the future. Keep up the great work that you're doing on YouTube. And yeah, it's been good.
Thank you. Bye.
All right, Raina, have a good one. Thank you for listening to the Teeth Time podcast. I hope this conversation was at least somewhat enjoyable for you. Remember to check out my YouTube channel. That's Stephen P. Ray on YouTube, where you'll find plenty of visual content about the life of a dental student and creator. Also check out my Instagram at stephen.p.ray.dentistry. Long name, I know. I appreciate each and every one of you. This has been Teeth Time, and I'm out.